Welcome to the COOP for Rural Hospitals webinar series. This is webinar number 2, COOP 101. In this webinar, we will review COOP fundamentals and the regulatory environment. Before we begin our webinar, let's review the components of the Rural Hospital COOP Toolkit. While this toolkit was designed specifically for rural hospitals, other hospitals or other healthcare organizations may find benefit from the elements in the toolkit. This toolkit has been specifically designed for rural hospitals and includes 6 components which you see listed on the graphic on the screen. The first component is a COOP plan completion guide, and the second component is a COOP plan template. These are designed to work together to help hospitals customize their COOP plan. The third component is a COOP tabletop exercise in a box that includes all the materials you would need to design and conduct a tabletop exercise at your hospital. The fourth component is a collection of resources related to COOP planning, specifically COOP planning industry standards and best practices. This curated list of resources may be helpful as you write or update your hospital's COOP plan. The fifth component is a frequently asked questions document to help you explain COOP planning to your peers and executive leaders. The sixth and final component of this toolkit is this series of webinars to help continuity planners complete or update their hospital's COOP plan. The webinars are focused on the first 2 components of the toolkit, the COOP completion guide and the COOP plan template. The completion guide has been designed with activities and explanations of how to write a COOP plan for your organization. As you complete the activities, you can move answers into the COOP template. The template can be edited or adjusted however you see fit to meet the needs of your organization. If you already have a COOP plan, you can use the completion guide to help augment or revise your current COOP plan. And now for webinar 2, COOP 101. In this webinar, we will focus on COOP fundamentals and the regulatory environment. This is a roadmap graphic that describes the 4 phases of COOP planning, and each phase corresponds to a bend in the road. There is a red chess piece that will move with us as we progress through this roadmap and progress through the webinars. Step 1 in the COOP planning process is to prepare. Preparing includes building your COOP planning team and setting up your project management plan, as well as understanding the COOP planning elements and the regulatory environment. Webinars 1 and 2 focus on step 1. Step 2 in the COOP planning process is to write your COOP plan. Webinars 3, 4, and 5 guide you through writing your COOP plan and using the COOP completion guide and the COOP planning template provided in the toolkit. Step 3 is to train and exercise so your staff know how to activate the COOP when needed. This will be covered in webinar 6. And finally, step number 4 is to evaluate and improve your COOP plan. This will also be covered in webinar 6. We will refer to this roadmap graphic and the 4 steps of COOP throughout this webinar series. Here we see our roadmap again, and our red chess piece has moved to step 1. In this webinar, we will focus on the differences between a COOP plan and your emergency operations plan, COOP planning elements, and COOP-related regulatory requirements. COOP planning includes several required elements, as you can see on the graphic on the screen. The most important of which are essential functions and supporting essential activities. The next webinar focuses specifically on identifying your essential functions. Vital records, databases, and IT systems are also critical for COOP planning. The next 3, orders of succession, delegations of authority, and staffing are all related to human resources. Next, we have continuity communications, followed by continuity facilities or alternate locations. Reconstitution is next, followed by devolution, and finally training and exercise and review. All of these sections are part of the COOP completion guide and COOP plan template provided in the toolkit. Let's talk about the relationship between your COOP plan and your emergency operations plan. On the screen, the left side of the image talks about your COOP. The focus of your COOP plan is to ensure your organization's essential functions continue during any kind of disruption or emergency. The COOP plan is typically an annex or a section of your EOP. The right side of the image is about your EOP. The EOP is the foundation of your emergency management program and describes how your organization manages an emergency. The EOP informs the development of the COOP plan. The graphic on the screen describes at a high level the differences between a COOP plan, described on the left, versus an EOP, described on the right. First, the COOP plan is focused on maintaining essential functions and your organization's continuity and viability, no matter what event may have impacted your facility or the surrounding community. Conversely, your EOP emphasizes the 4 phases of emergency management: mitigation, preparedness, response, and recovery. It describes how you would bring together a group of people to manage the response to an incident. Second, the COOP plan applies to any business interruption. Your EOP, on the other hand, supports emergency response and prioritizes your greatest risks or vulnerabilities. This scope is larger than your essential functions, but they may intersect. Next, your COOP outlines organizational and/or department-specific plans based on your essential functions. Your EOP, however, has incident-specific response plans. Finally, your COOP plan has a long-term recovery focus. We aim for our essential functions to be viable within 12 hours of an interruption. Your EOP may include plans for up to 96 hours of a response. As we move into step 2 to COOP on our roadmap, you will hear more about how these plans intersect. As of this recording, CMS, the Joint Commission, and the Hospital Preparedness Program have requirements for COOP planning. CMS requires that participating organizations address patient population, including continuity of operations, delegation of authority, and succession plans. Additionally, CMS requires participating organizations to maintain the continuity of services to hospital patients. The Joint Commission's emergency management standards require a written plan for COOP, a secondary location, a succession plan, and delegations of authority. Finally, the Hospital Preparedness Program has continuity of healthcare service delivery as an outcome and has listed continuity and recovery as a core function. If your organization uses a different accreditation organization, it is important to look to see if they have any regulatory requirements for COOP planning. That brings us to the end of Webinar 2, COOP 101. In the next webinar, we will move to Step 2 and begin writing our COOP plan by identifying our essential functions. This webinar was prepared and recorded by All Clear Emergency Management Group under contract with the Minnesota Department of Health Emergency Preparedness and Response Division. If you have any questions, please see their website at www.health.state.mn.us/about/org/EPR.